At 67, Robert thought the sharp pain in his chest was just heartburn from his wife's spicy lasagna. He ignored it for 3 days, taking antacids and hoping it would pass. On the 4th morning, he collapsed in his kitchen while making coffee. His wife found him unconscious on the floor, barely breathing. The paramedics arrived just in time. The doctor later told them that Robert had been having a heart attack for days, and those chest pains weren't heartburn at all. They were his body's desperate cry for help. Robert's story isn't unique. Every day, thousands of people over 60 dismiss critical warning signs as normal aging, minor discomfort, or something that will go away on its own. But here's the terrifying truth. After 60, certain types of pain are never just pain. They're emergency signals that demand immediate attention, and ignoring them can cost you your life. Today, we're going to explore 3 specific pain locations that doctors say you must never, ever ignore after 60. These aren't the usual aches and pains that come with getting older. These are the silent killers, the warning signs that separate those who live to see their grandchildren grow up and those who don't. Before we begin, I want you to think about this. How many times have you felt pain and told yourself it's probably nothing? How many times have you waited, hoping it would just disappear? If you're watching this video, chances are you or someone you love has experienced unexplained pain and wondered whether it was serious enough to worry about. Drop a comment below and let me know where you're watching from. And don't forget to subscribe, because the information I'm about to share could literally save your life or the life of someone you care about. Let's start with the most deceptive pain of all, the one that fooled Robert and fools thousands of others every single day. Pain location. Number 1. Chest pain that doesn't feel like a heart attack. When most people think of heart attack pain, they picture someone clutching their chest dramatically, falling to the ground in obvious distress. The reality is far more subtle and infinitely more dangerous. After 60, heart attack pain often masquerades as something completely harmless. Let me tell you about Margaret, a 72-year-old retired teacher who loved gardening. For 2 weeks, she felt a dull, nagging pain between her shoulder blades whenever she worked in her flower beds. She assumed it was muscle strain from bending over too much. The pain would come and go, sometimes moving to her jaw, sometimes settling in her upper back like a tight knot. Margaret never felt the classic crushing chest pain you see in movies. Instead, she experienced what doctors call atypical heart attack symptoms, which are actually more common in people over 60, especially women. The pain was subtle, inconsistent, and easy to dismiss. She even mentioned it to her daughter, laughing it off as getting old and stiff. 3 weeks later, Margaret was rushed to the hospital during what she thought was a particularly bad episode of acid reflux. It wasn't reflux. It was a massive heart attack, and those weeks of shoulder and jaw pain had been her heart muscles slowly dying from lack of oxygen. Here's what makes this so dangerous. As we age, our nervous system becomes less sensitive to pain. The classic symptoms of a heart attack, crushing chest pain, shortness of breath, and radiating arm pain, may be much milder or completely absent in older adults. Instead, you might experience pain that feels like indigestion, a pulled muscle, or even a tension headache. The American Heart Association reports that people over 60 are twice as likely to experience silent heart attacks, where the damage occurs without obvious symptoms. But here's the crucial part. Just because the pain is subtle doesn't mean the damage is minor. These silent heart attacks can be just as deadly as the dramatic ones. So what should you be looking for? Any unexplained chest discomfort, even if it feels mild or comes and goes. Pay attention to pain that radiates to your shoulders, neck, jaw, or back. Be especially concerned if this pain is accompanied by unusual fatigue, nausea, dizziness, or shortness of breath during normal activities. Dr. Sarah Chen, a leading cardiologist at Johns Hopkins, explains it this way. After 60, your heart may be crying for help in whispers rather than screams. Those whispers might sound like heartburn, muscle strain, or just feeling unusually tired. The key is recognizing that any new, unexplained discomfort in your chest, shoulders, or upper back deserves immediate medical attention. But chest pain isn't the only location where your body might be sending you life-saving warnings. Let's talk about the second pain location that could mean the difference between life and death. Pain location number 2. Severe headaches that are different from your normal headaches. Helen had suffered from occasional headaches her entire adult life. At 71, she considered herself an expert on her own pain patterns. She knew exactly how her tension headaches felt, what triggered her sinus headaches, and how to manage them with over-the-counter medications. But on a Tuesday morning in March, Helen woke up with a headache unlike anything she'd ever experienced. It wasn't gradual like her usual headaches. It hit her like a lightning bolt, sudden and excruciating. She described it later as feeling like someone had struck her in the head with a baseball bat. Helen's first instinct was to take her usual pain medication and lie down, but something felt different. The pain was accompanied by nausea so severe she couldn't keep water down. Her vision became blurry, and she felt confused, struggling to remember simple things, like her daughter's phone number. Fortunately, Helen's neighbor found her disoriented in her garden that afternoon, and immediately called an ambulance. The CT scan revealed that Helen was having a stroke. The sudden, severe headache was caused by a blood vessel bursting in her brain, and every minute of delay could have meant permanent brain damage or death. After 60, sudden severe headaches are never something to ignore, especially if they're different from any headache you've experienced before. These headaches can signal several life-threatening conditions: stroke, brain aneurysm, meningitis, or dangerously high blood pressure. Here's what makes this particularly treacherous. Many older adults have experienced headaches throughout their lives and become desensitized to them. They think they know what's normal for their body, but a headache that's sudden, severe, and different from your usual pattern is your brain's emergency alarm system. The medical community has a term for this: thunderclap headache. It reaches maximum intensity within seconds to minutes and feels like the worst headache of your life. If you've never experienced anything like it before, this is a medical emergency that requires immediate hospital care. Dr. Michael Rodriguez, a neurologist with 25 years of experience treating stroke patients, puts it bluntly: "I've seen too many people over 60 who waited hours or even days to seek help for severe headaches because they thought they could tough it out. In stroke care, we say time is brain. Every minute that passes without treatment means more brain cells die permanently." But it's not just sudden thunderclap headaches you need to worry about. Any headache that's progressively getting worse over days or weeks, especially if it's accompanied by changes in vision, speech, or coordination, could indicate a growing brain tumor or increasing pressure in your skull. Pay attention to headaches that wake you up at night, headaches that get worse when you cough or bend over, or headaches accompanied by fever, stiff neck, or confusion. These combinations of symptoms can indicate serious conditions that require immediate medical intervention. The rule is simple: if you're over 60 and you experience a headache that's different from your normal pattern, don't wait. Don't take a nap and hope it passes. Don't assume it's just stress or dehydration. Get medical attention immediately. Now, let's discuss the third pain location that's often overlooked but can be just as dangerous. Pain location number 3. Abdominal pain that feels like more than indigestion. At 69, William prided himself on his strong stomach. He'd eaten spicy food his whole life, rarely had digestive problems, and could handle meals that would send younger people reaching for antacids. So when he started feeling a gnawing pain in his upper abdomen after meals, he assumed it was just age catching up with his digestive system. The pain was persistent but not overwhelming. It felt like a burning sensation that would start about an hour after eating and gradually fade. William bought stronger antacids, started eating smaller meals, and even tried avoiding spicy foods. but the pain kept returning, sometimes accompanied by a feeling of fullness, even after eating very little. For 3 months, William managed his symptoms with over-the-counter medications and dietary changes. He mentioned it to his wife, but they both agreed it was probably just acid reflux or maybe an ulcer. It wasn't until the pain became so severe that he couldn't sleep, and he started vomiting blood, that they realized something was seriously wrong. The emergency room doctor delivered devastating news. William had advanced pancreatic cancer. The persistent abdominal pain he'd been treating as indigestion was actually a tumor growing in his pancreas. The 3 months of dismissed symptoms had allowed the cancer to spread to his liver and lymph nodes. Pancreatic cancer is particularly cruel because its early symptoms mimic common digestive problems. The pain is often described as a dull ache in the upper abdomen that may radiate to the back. It can feel like indigestion, gas, or muscle strain. By the time the pain becomes severe enough to seek medical attention, the cancer has often advanced to a stage where treatment options are limited. Dr. Amanda Foster, an oncologist specializing in gastrointestinal cancers, explains, pancreatic cancer is called the silent killer because its early symptoms are so vague and easily dismissed. In patients over 60, any new persistent abdominal pain, especially if it's accompanied by unexplained weight loss, changes in bowel habits, or loss of appetite, should be investigated immediately. But pancreatic cancer isn't the only serious condition that can present as abdominal pain in older adults. A heart attack can sometimes cause pain in the upper abdomen, especially in women. This is particularly dangerous because people experiencing a heart attack with abdominal pain are less likely to seek emergency care quickly. Appendicitis in older adults can also be misleading. While younger people typically experience severe pain in the lower right abdomen, older adults may have milder, more diffuse pain that's easily confused with other digestive issues. The classic signs of appendicitis, fever, nausea, and localized tenderness may be less pronounced in people over 60. Bowel obstructions, gallbladder disease, and abdominal aortic aneurysms can all cause abdominal pain that might be dismissed as indigestion or gas. But these conditions can be life-threatening if not treated promptly. Here's what you need to watch for. Any abdominal pain that's new, persistent, or gradually worsening over days or weeks. Be especially concerned if the pain is accompanied by unexplained weight loss, changes in bowel habits, persistent nausea, or vomiting or fever. Pay attention to pain that wakes you up at night or prevents you from eating normally. If you find yourself avoiding certain foods or eating smaller portions because of pain, this isn't normal aging, it's a warning sign. The location of the pain can provide important clues. Upper abdominal pain, especially if it radiates to your back, could indicate pancreatic problems, gallbladder disease, or even a heart attack. Lower abdominal pain might suggest bowel problems, urinary tract issues, or appendicitis. But here's the crucial point. You don't need to diagnose yourself. Your job is to recognize when something isn't right and seek medical attention. Let the professionals determine whether your abdominal pain is serious or benign. The common thread, why these pains are so dangerous after 60. Now that we've explored these 3 critical pain locations, let's talk about why they're particularly dangerous for people over 60. The answer lies in how our bodies change as we age, and why the normal rules of pain perception no longer apply. First, our nervous system becomes less sensitive to pain as we age. This might sound like a good thing, but it's actually dangerous. The pain signals that would send a younger person to the emergency room might feel manageable to someone over 60. This delayed or diminished pain response can be life-threatening when dealing with conditions like heart attacks, strokes, or cancer. Second, older adults are more likely to attribute new symptoms to normal aging. When you've lived with a body for 6 or 7 decades, you expect some aches and pains. The problem is that serious medical conditions can hide behind this expectation of normal aging. Third, many people over 60 take multiple medications that can mask symptoms or interfere with normal pain perception. Blood thinners, blood pressure medications, and pain relievers can all affect how your body responds to and signals medical emergencies. Dr. James Patterson, a geriatrician with 30 years of experience, explains it this way. The biggest danger I see in my practice is patients who dismiss serious symptoms as just getting old. Age alone doesn't cause chest pain, severe headaches, or persistent abdominal pain. These symptoms always have a cause, and after 60, that cause is more likely to be serious. There's also the factor of social isolation. Many older adults live alone or have limited social contact. This means there's no one around to notice when something's wrong or to encourage them to seek medical care. The person who might have insisted on going to the emergency room for chest pain at 40 might convince themselves it's nothing at 70. When to seek immediate medical attention. Let's be absolutely clear about when these three types of pain require emergency care. This isn't about being overly cautious or wasting medical resources. This is about recognizing when your life might be in danger. For chest pain, seek immediate medical attention if you experience any chest discomfort, especially if it's new or different from anything you felt before. Don't wait to see if it gets worse. Don't try to treat it with antacids or pain medication. If you're experiencing chest pain along with shortness of breath, nausea, sweating, or dizziness, call an ambulance immediately. Remember, heart attack symptoms in people over 60 can be subtle. You might feel like you have indigestion, muscle strain, or just unusual fatigue. Trust your instincts. If something feels wrong, get medical attention. For severe headaches, seek emergency care for any headache that's sudden, severe, and different from your normal pattern. If you describe it as the worst headache of your life, don't wait. Call an ambulance. Also seek immediate care for headaches accompanied by confusion, vision changes, difficulty speaking, weakness, or fever. Don't try to sleep off a severe headache. Don't assume it's just stress or dehydration. In stroke care, every minute counts. The treatments that can save your brain and your life are only effective if given quickly. For abdominal pain, seek medical attention for any persistent pain that's new or worsening, especially if it's accompanied by vomiting, fever, or changes in bowel habits. Don't wait to see if it gets better on its own. Don't assume it's just something you ate or normal digestive issues. If you're experiencing severe abdominal pain that prevents you from standing up straight, or if you're vomiting blood, call an ambulance immediately. These could be signs of a life-threatening emergency. The stories that could have been different. Let me share with you what happened to Robert, Margaret, Helen, and William after their medical emergencies, because their outcomes illustrate why recognizing these warning signs is so important. Robert, who ignored his chest pain for 3 days, survived his heart attack but suffered permanent heart damage. His ejection fraction, which measures how well his heart pumps blood, was reduced to 30%. He now lives with heart failure, requires multiple medications, and can no longer do many of the activities he loved. His cardiologist told him that if he had sought treatment when the chest pain first started, the heart damage could have been prevented. Margaret, who dismissed her shoulder and jaw pain as muscle strain, also survived, but she wasn't as fortunate. The delay in treatment meant that a large portion of her heart muscle died. She now requires a pacemaker and has severely limited physical capacity. Simple tasks like climbing stairs or carrying groceries leave her breathless and exhausted. Helen, who experienced the sudden severe headache, had a better outcome because her neighbor found her quickly and she received immediate medical care. The stroke treatment she received within the first few hours saved her life and prevented permanent brain damage. She made a full recovery and is now an advocate for stroke awareness in her community. William's story is the most tragic. By the time his pancreatic cancer was diagnosed, it had spread too far for curative treatment. He passed away 8 months after his diagnosis. His oncologist later told his family that if the persistent abdominal pain had been investigated earlier, the cancer might have been caught at a treatable stage. These stories illustrate a crucial point: the difference between life and death, between full recovery and permanent disability, often comes down to how quickly we recognize and respond to warning signs. Beyond the 3 other warning signs to watch for while, we've focused on 3 critical pain locations. There are other warning signs that people over 60 should never ignore. Let's briefly discuss a few of them. Sudden leg pain, especially if it's accompanied by swelling, redness, or warmth, could indicate a blood clot. Blood clots are more common in older adults and can be life-threatening if they travel to the lungs. Sudden changes in vision, speech, or coordination, even if they seem to resolve on their own, could indicate a transient ischemic attack or mini-stroke. These are warning signs that a major stroke may be coming. Persistent fatigue that's new or significantly worse than usual, especially if it's accompanied by other symptoms like shortness of breath, chest pain, or unexplained weight loss, could indicate heart disease, cancer, or other serious conditions. Sudden severe back pain, especially if it's accompanied by weakness in the legs or loss of bladder control, could indicate a spinal emergency that requires immediate surgery. The key is learning to trust your instincts. You know your body better than anyone else. If something feels wrong, if a symptom is new or different, don't dismiss it. Don't wait to see if it gets better. Your life might depend on taking action quickly. The psychological barriers to seeking help. One of the biggest challenges in getting people over 60 to seek medical care for warning signs is overcoming the psychological barriers that prevent them from taking action. Let's talk about these barriers honestly, because understanding them is the first step in overcoming them. Many older adults worry about being a burden on their families or the healthcare system. They don't want to cause a fuss or waste anyone's time. This mindset can be deadly. Your life is not a burden. Your health is not an inconvenience. The people who love you would rather deal with a false alarm than lose you to a preventable tragedy. There's also the fear of what doctors might find. Some people avoid seeking medical care because they're afraid of receiving bad news. But here's the reality: ignoring symptoms doesn't make them go away. It just allows treatable conditions to become untreatable ones. Financial concerns also play a role. Many older adults on fixed incomes worry about the cost of emergency care or unnecessary tests. While these concerns are understandable, they shouldn't prevent you from seeking life-saving treatment. Most hospitals are required to provide emergency care regardless of ability to pay, and many have financial assistance programs. Pride and independence can also be barriers. Many older adults have spent their lives taking care of others and find it difficult to admit they need help, but recognizing warning signs and seeking appropriate medical care isn't a sign of weakness. It's a sign of wisdom and self-advocacy. Creating your personal action plan. Now that you understand the warning signs, let's create a practical action plan for you and your loved ones. This isn't about living in fear or becoming a hypochondriac. It's about being prepared and knowing how to respond when warning signs appear. First, have a conversation with your doctor about your risk factors and what symptoms you should watch for based on your personal medical history. Every person's risk profile is different, and your doctor can help you understand what's most important for your specific situation. Second, create an emergency contact list and keep it easily accessible. Include your doctor's phone number, the nearest hospital, and emergency contacts for family members. Make sure this information is readily available to anyone who might need it. Third, don't ignore your instincts. If something feels wrong, trust that feeling. You're not being dramatic or overreacting. You're being smart and proactive about your health. Fourth, educate your family members about these warning signs. Make sure they know to take your symptoms seriously and to encourage you to seek medical care when appropriate. Sometimes it takes an outside perspective to recognize when something isn't normal. Fifth, prepare for emergencies. Know the quickest route to your nearest hospital. Consider wearing a medical alert device if you live alone. Keep important medical information easily accessible for emergency responders. The importance of regular checkups. While recognizing emergency warning signs is crucial, it's equally important to maintain regular contact with your healthcare providers. Many of the conditions we've discussed today can be prevented or caught early through regular screening and monitoring. Regular checkups allow your doctor to establish baseline measurements for your health. They can detect changes in your blood pressure, heart rhythm, blood sugar, and other vital signs before they become emergencies. Many heart attacks, strokes, and cancers give subtle warning signs long before they become life-threatening. Don't skip appointments because you feel fine. Some of the most dangerous conditions, like high blood pressure and early-stage cancers, often have no symptoms until they're advanced. Regular screening can catch these conditions when they're most treatable. Be honest with your healthcare providers about any symptoms you're experiencing, even if they seem minor. That occasional chest discomfort, those headaches that are slightly different from usual, or that abdominal pain that comes and goes might be important pieces of a larger puzzle, a message of hope and empowerment. As we near the end of our discussion, I want to leave you with a message of hope and empowerment. Yes, the information we've covered today is serious, and yes, the consequences of ignoring warning signs can be tragic. But the flip side is equally true. Recognizing and responding to these signs can save your life and preserve your quality of life. You have more control over your health outcomes than you might think. By staying informed, listening to your body, and seeking appropriate medical care when needed, you can significantly reduce your risk of serious complications from heart disease, stroke, cancer, and other conditions. The stories of Robert, Margaret, Helen, and William don't have to be your story. You can choose to pay attention to warning signs. You can choose to seek medical care when something doesn't feel right. You can choose to advocate for your own health and well-being. Every day, people over 60 successfully navigate health challenges because they recognized warning signs early and took appropriate action. They're living full, active lives because they didn't ignore their body's signals for help. Taking action today. So what should you do with this information? First, share it with the people you care about. Forward this video to family members and friends who are over 60. These warning signs could save their lives too. Second, have a conversation with your doctor about your personal risk factors and what symptoms you should watch for. Don't wait for your next scheduled appointment if you have concerns. Call and schedule a discussion about your health risks and warning signs. Third, create that emergency action plan we discussed. Make sure you know how to quickly access medical care if you need it. Make sure your family knows about these warning signs and understands the importance of taking them seriously. Fourth, trust yourself. You are the expert on your own body. If something feels wrong, if a symptom is new or different, don't dismiss it. Don't assume it's just normal aging. Seek medical attention and let the professionals determine whether your symptoms are serious. Remember, the goal isn't to live in fear or to rush to the emergency room for every ache and pain. The goal is to be informed, alert, and proactive about your health. The goal is to recognize when your body is sending you emergency signals and to respond appropriately. The 3 pain locations we've discussed today: chest pain that doesn't feel like a heart attack, severe headaches that are different from your normal pattern, and abdominal pain that feels like more than indigestion, are your body's way of asking for help. Don't ignore these requests. They might be the most important conversations you ever have with your body. Your health is worth fighting for. Your life is worth protecting. And the people who love you are counting on you to take care of yourself. By staying informed and alert to these warning signs, you're not just protecting yourself, you're protecting your ability to be there for the people who matter most to you. Take care of yourself, listen to your body, and remember that seeking medical care when something doesn't feel right isn't a sign of weakness. It's a sign of wisdom, self-advocacy, and a commitment to living your best life for as long as possible. If this information has been helpful to you, please share it with others who might benefit from it. Leave a comment below and let me know if you have questions or if there are other health topics you'd like me to cover. And don't forget to subscribe for more important health information that could make a real difference in your life. Stay healthy, stay alert, and remember that your body is always trying to communicate with you. The key is learning to listen and knowing how to respond when it's asking for help.